Hi, I'm Dr. Sean.
I'm Dr. Xenia.
And thank you for coming to watch our little presentation. And biggest thanks to Korina, who is a dear friend of ours. She stayed with us for about 2 weeks in November and was a huge help, has an amazingly positive attitude, which I'm sure you've all experienced by now since we're coming at the end. We want to just talk to you a little bit about what we do here from the doctor's perspective and the naturopathic perspective, and some of the modalities we use. A little bit about lessons we've learned that will help you in your international travels, and especially in Haiti. So we are seeing patients 3 times a week now. We just expanded it when we got a second translator. And we're seeing about 100 a week now. We do 40 for kids and then 20 adults on Saturdays. And when the NWB Bastyr group comes, we'll be seeing even more, because we're going to be working every day in the clinic, getting as many contacts as you can. So I know at SCNM it was about 700 patient contacts just to graduate. It took 2 years to get that, and here you could do it in like 7 weeks. So, so that'd be pretty sweet.
So a couple of the things that I've learned since being here, I've been here about 2 months now, are that, you know, we use all of these modalities and we learn so much in school, and oftentimes we're limited in the patients we treat just based on what kind of conditions we see in the United States and what kind of conditions we see in the areas that we're practicing. And here I feel like not only are we able to utilize all of the modalities, but we're using so many of the things that we've only learned about and we've never really been able to use. I mean, we're prescribing remedies for cholera and for acute, bloody, mucousy, diarrhea, things that you would only rarely see there. We've also made these really awesome homeopathic flowcharts, so don't worry if you're not homeo nerds like us, it'll be okay. We've got these awesome flowcharts and remedies to be able to study, so fear not if you are not solid in your homeopathic skills and knowledge. I mean, you'll learn a ton here. I can't imagine that you will leave without learning at least 5 new remedies and probably becoming very, very solid in 20 to 30 more, of the polycrest of the remedies that we see all the time. Another thing we're using a ton of is botanical medicine, and it's working phenomenally. And I don't know if it's just due to the fact that most of these people haven't been introduced to these botanicals, and they're kind of like unadulterated, and they haven't had so many medications, and so a little bit goes a long way. I mean, we're seeing kids with impetigo and worms and cellulitis and tinea and all of these other really intense things that are going away within a week, 10 days, sometimes even less, with the use of these botanicals and homeopathics, supplements. The activator is awesome. It's something that I never was able to get my hands on before in clinical practice, and we use it a ton. I mean, we use it on each other, we use it on the patients. I mean, even the kids, they really enjoy it. I mean, Dr. Sean was able to cure a kid, 4 years of chronic headaches.
Fell off his bike on his head. Twice a week headaches.
Yeah. Gone with the activator, and he still will come in, and we think last time he may have been fibbing about the headache returning, because he really enjoys spending time with Dr. Sean and the activator.
Every time I click him, he just gets this big grin on his face.
He's like, yay!
Like, do it more.
So if your interest is pediatrics, and even if it's not, we're seeing tons of kids, we're seeing adults with all sorts of chronic conditions. And the same with a lot of the patients that we saw in the clinic in the US. We're getting people who are saying, I've been to every doctor, I've been to the hospital, I've been given these meds and nothing worked, we're here. And then we treat them, and a couple weeks later they come back for a follow-up, and they're like, it worked, I've never had this kind of reaction before. And they're so thankful, and it feels so good to be able to treat them in that manner. And be able to get such awesome results. You really see, hardcore nature cure, naturopathic medicine work here, But on the flip side, we also use pharmaceuticals when we need to, and we see them work really well too. So, we're not, I don't feel like we're lacking in that area, like we're just being able to use certain modalities and that we're forgetting anything else. I feel like, if anything, we're using more of the things that we've learned here than we would anywhere else.
Definitely.
I don't know. So I don't know, some of the other things, maybe you can talk about some of the emergent conditions that we saw, the woman that we sent to the hospital. And
yeah, most of the emergent conditions are from moms coming in who are having high blood pressure, or the baby's heart rate isn't doing well. And Edie is our American midwife and Jean-Marie is our Haitian midwife, and they do not hesitate to play it safe, send them to the hospital. We've seen people with blood pressures, geez, that one lady was 250 for like 130, and starting to waver in her consciousness. So we sent her, and then we saw her a few days later, and she was fine. She got the proper management, medication, and she really just thanked us for making that call and not just being dogmatic about it. Geez, all kinds of kid with osteomyelitis that we had to send to the hospital because that can go septic very quickly. Just other conditions like that.
The girl with the finger that we
Oh,
triaged.
man. Little girl had her thumb caught in a metal gate that closed, and she just lost all of her nail in the matrix. We saw a bone. It was a little more than our minor surgery skills were wanting to handle. So we sent her to the Justinian Hospital, the main public hospital in Cap, and they stitched her up beautifully. Took really good care of her, and the thumb looks great. It's a little white where there should be nails, so it actually doesn't look that much different from just a normal thumbnail. So all kinds of cool stuff we see, and really I promise you, if you come here, we'll give you a great clinical experience. We're going to teach you whatever you can cram into your week or 2 weeks or 3 months, your whole quarter, semester, whatever it is you want to come for. Make sure that we do our best to give you an awesome experience. So that's about all I can think of. There's just so many lessons that you'll learn from Haiti and from your international travels. I really encourage you to go wherever you can. Go to Mexico with NWB, or go to Guatemala with NMGH, or Nepal with NI, or whatever it is you want to do. There's so many options. And there's just 7 billion people we're up to now? 7 billion people in need of help. So don't hesitate to just get out there, use your skills. You know more than you think you do.
Yeah, absolutely.
They need your help. So.
Absolutely. I agree completely.
Thanks for coming to our little presentation. Thank you again, Korina, for sharing your experiences, however varied. And we'll talk to y'all later.
Hope to see you soon.
All right, bye-bye.
Bye.